Imagine waking up one day with a burning pain that feels like your skin is on fire. Then, small, blistering rashes appear on your body, adding to the discomfort. For many, this isn't just a nightmare, it's the reality of shingles. Shingles is a viral infection that doesn't just go away with a few days of rest. The pain can last for weeks, sometimes even years. What if there was a way to ease that pain, something natural, that's been used for thousands of years? That's where acupuncture comes into the conversation. But does it really help? Understanding shingles, a painful viral reaction. Shingles comes from the reactivation of the varicella zoster virus, the same virus that causes chickenpox. After someone recovers from chickenpox, the virus can lay dormant in the body for decades. Then one day, often triggered by stress or a weakened immune system, it strikes back, and the result is shingles. The initial symptoms are often a tingling sensation or localized pain, which eventually turns into a painful rash. The whole ordeal usually lasts 3 to 5 weeks, but some people experience an ongoing nerve pain known as post-herpetic neuralgia, PHN, long after the rash disappears. About 1/3 of people in the US will develop shingles at some point in their lives, and with age, the risk of complications like PHN increases. There's no cure for shingles, so managing the symptoms is crucial. This is where acupuncture and other treatments come in. What is acupuncture? Acupuncture is a practice with roots in ancient Chinese medicine, where thin needles are inserted into specific points of the body. According to traditional beliefs, these points are located on channels or meridians through which life energy, known as qi, flows. Pain and illness are thought to result from blockages or imbalances in this flow of energy. When the needles are inserted, they supposedly help to unblock or balance the qi, allowing the body to heal itself. But beyond traditional explanations, modern research offers another perspective. Acupuncture may trigger the release of natural pain-relieving chemicals in the body, help with blood flow, and reduce inflammation factors that could make a real difference for someone suffering from the pain of shingles. Can acupuncture really help with shingles? When faced with the agony of shingles or PHN, people are often willing to try anything that might offer relief. So, can acupuncture deliver? According to several studies, acupuncture does show promise. For example, a 2019 systematic review found that acupuncture might reduce pain intensity, ease anxiety, and improve the quality of life for people suffering from PHN. This aligns with earlier findings that acupuncture could be a safe and effective option for pain management, although the research isn't definitive. Some suggest that acupuncture may work just as much because of people's expectations or beliefs in its effectiveness as it does from the needles themselves. But here's the thing, while it may not be the ultimate solution, acupuncture is generally considered safe when performed by a trained and licensed practitioner. So, for people looking for a natural, low-risk way to manage shingles pain, it might be worth a try. The science behind acupuncture and pain relief. While scientists haven't fully unlocked the mystery of how acupuncture works, some theories are beginning to take shape. One explanation is that acupuncture stimulates the nervous system, releasing endorphins, our body's natural painkillers. These endorphins can help to reduce pain and create a sense of well-being. Another possibility is that acupuncture helps improve blood flow, which could promote healing and reduce inflammation. Some research even suggests acupuncture could help regulate the body's stress response, which is significant because stress is a known trigger for shingles outbreaks. But again, while the science is still evolving, the evidence so far is encouraging for those dealing with the intense pain of shingles. What the experts say. Organizations like the British Acupuncture Council acknowledge that while acupuncture shows potential, more research is needed to fully understand its effects on shingles pain. However, they emphasize that it is generally a safe treatment option. A growing number of people are turning to acupuncture not just for shingles, but for chronic pain conditions in general. According to the National Center for Complementary and Integrative Health, NCHE, acupuncture is considered safe when performed by a trained practitioner using sterile needles. However, like any treatment, it's not without risks. There have been rare reports of adverse effects, such as injury to the nervous system, but these cases are the exception rather than the rule. Other treatment options for shingles. While acupuncture might be a helpful addition to your pain management toolbox, it's not the only option. Conventional treatments are often necessary to combat the symptoms of shingles. Antiviral medications. A doctor may prescribe antiviral drugs such as acyclovir or valacyclovir to shorten the length and severity of a shingles outbreak. These are most effective when taken within 72 hours of the rash appearing. Pain relievers. Over-the-counter pain medications like ibuprofen can help manage discomfort. For more intense pain, doctors may recommend stronger options such as lidocaine patches or gabapentin, a drug commonly used to treat nerve pain. Shingles vaccine. The CDC recommends that adults aged 50 and older get the shingles vaccine, Shingrix. While this won't cure shingles, it can significantly reduce the risk of getting it in the first place, as well as lower the chances of developing PHN. Home remedies. Cool compresses, oatmeal baths, and calamine lotion can help soothe the itchy, burning rash caused by shingles. These remedies don't cure the virus but can provide much-needed relief during the healing process. Stress management. Since stress can exacerbate shingles, finding ways to stay calm and relaxed is crucial. Activities like yoga, tai chi, or simply engaging in a hobby can help distract from pain and aid in recovery. Essential oils, a complementary option. Some people also explore using essential oils, such as peppermint or thyme, for shingles pain relief. While more research is needed in this area, certain oils may have anti-inflammatory or soothing properties. However, caution is essential. Essential oils can cause skin irritation and should always be diluted before applying them to your skin. When to talk to a doctor. If you suspect you have shingles or are experiencing ongoing nerve pain, it's important to speak with your doctor. They can help you find the right treatment plan, which might include acupuncture or other therapies. If acupuncture doesn't seem to help or worsens the pain, it's critical to stop and consult your healthcare provider for alternative options. Conclusion: a balanced approach to shingles pain relief. Shingles can be a painful and disruptive experience, but you don't have to suffer in silence. Acupuncture offers a natural, time-tested way to manage pain, and for many, it's worth considering as part of a broader treatment plan. While it may not be a cure-all, it can provide some relief for the intense discomfort of shingles, especially when combined with antiviral medications, home remedies, and stress management techniques. Ultimately, the key is finding what works best for you. Whether it's acupuncture, antiviral medication, or a combination of treatments, managing shingles pain is about taking control and exploring all the options available to you.